on there about what's going on, but you know, this is going to be a long-term situation for our family, so I guess I kind of have to let you guys know.
Yep.
You know, I gotta, you know, do something. Like,
that's right.
it's just better to know that I'm not.
All right, we got John. I hear the AirPod case snapping in the background. So John's audio works.
My audio works. Testing. Simile.
One. Go.
Well, good morning, everybody. Thank you for attending the third Summer Leadership Series webinar. On this time, we're going to talk about what have we learned. And so with this session, we're talking about leading by example in the AM industry. With me today, I've got Benny Bowler, founder, CEO of Bello 3D, Dr. Beth Ripley, director of the 3D Print Network at the Veterans Administration, and Brad Rothenberg, founder and CEO of nTopology. But first, a little note from our sponsors. The Purdue AM certificate. You can earn your AM certificate. It's 100% online. Start when you want, move at your own pace. It's by engineers for working professionals, and there's a new lower price. So all you need to do to register is go to barnesglobaladvisors.com, hit the training button at the top, and follow the instructions. And also by Neighborhood 91, the Additive Manufacturing campus located at the Pittsburgh International Airport. It is under construction, and the first building is sold out. So now that we've covered the housekeeping, my name is John Barnes. I'm the managing director at the Barnes Global Advisors, the leading independent AM engineering firm. And with me, we've got Dr. Beth Ripley. Beth, you want to introduce yourself? Good morning.
Good morning. My name's Beth Ripley. I am a radiologist in the Veterans Health Administration based out of Seattle. More importantly, though, for this conversation, I am an avid additive manufacturing user in the medical space for the past, now 7 years. And my role within VHA is to build out infrastructure and knowledge across the VA hospitals to harness the power of additive for patient care.
Morning, Beth. And Benny, good morning. You want to introduce yourself?
Good morning. So I'm the CEO and founder of Bello 3D. We are a metal additive manufacturing company founded in 2014.
Great. And Brad, my fellow East Coaster.
Hey, yes. Good morning, everybody. And John, thanks for having us. So Brad Rothenberg, founder, CEO of nTopology. We're building, and we have the most advanced engineering software to really empower engineers to make and design revolutionary products, and specifically around utilization of advanced manufacturing.
Well, thank you for joining us this morning. I think this is an interesting panel. It's a little bit different than most, and I think it was born out of kind of conversations that each of us had over the last 3 to 6 months, which had an impact on me personally. So it kind of struck me as, what have we learned? And I didn't share this with you, but Benny sent me the video clip from, what movie was that with Brad Pitt?
Burn After Reading.
Burn After Reading. So there's a dialogue at the end after the whole thing's done and over with. The character sits back. He's with one of the government agencies. He's like, what have we learned? And the guy says, I don't know. He goes, not sure I know what happened. So it did seem to capture the essence of this conversation, but it's been a pretty crazy year. I've seen you guys behave in a strong leadership way, either outwardly or inwardly. We've seen some strong indications where additive manufacturing can be useful in these very unusual circumstances and unusual ways of operating. We don't really know what's next, but if you guys know what's next, that's a good thing to talk about. And, this is a dialogue. So for the people who are attending in the audience, feel free to ask us questions and we'll incorporate that into it. This is very much about a discussion. So with that, some of the observations that I had around in the early days of the pandemic, I think each of us had our own kind of experience that we were trying to work through Brad being in New York and the kind of the center of things. Benny, I think you were struggling with lack of, let's say, overall guidance on what to do. Us as individual leaders can exert responsibility, and Beth being, you know, in the front lines, so to speak, of in a hospital environment. This meant something kind of different to you. So maybe I'll lead off with Brad. Those first couple of days, you know, what did you guys do to ensure, you know, the safety and security of your business, but also your staff, and, you know, what was kind of happening? What did you see your responsibility in the first months?
Definitely. Well, so it's really interesting, obviously, being at the center at that point in the pandemic in New York. We were very aware of it early. And in fact, we had a board meeting in the first week of March, and one of the board members didn't come to New York City and was like, oh, I'm in my house outside of San Francisco and we're going to be in lockdown. I'm prepared through Labor Day with food in lockdown. And after Labor Day, things will open up and we'll be totally fine. And everybody at the board was like, you're crazy. This is not possible. This is insane. But obviously it's the opposite of that. Like, he was the most sane one. And, you know, one of the board members was like, oh, stop it. You know, you should be coming to New York for that. But, you know, within a week of that board meeting, we were fully remote, and we've been fully remote since then. And it was really quickly, actually, when we went into lockdown, we decided as a company, before the official New York City lockdown started, that we were going to do a test to see how our remote working could work for a day. That 1-day test became 2 days, which became permanent. And very quickly, we, you know, I like to say that going into fully remote from a company where we had a single office headquarters in New York with, you know, 70 people working out of the office here, it's forced the management at nTop to really become better managers and better communicators. And so, you know, very quickly, we started to adapt. We started doing or twice a week, not bi-weekly, twice a week, all hands presentations. In the beginning of the week, all the executives get up and present, okay, here are the goals for the week. Here's how they align with the goals for the quarter. And at the end of the week, we have kind of like a demo day where, you know, product team could show off a new spec. The engineers might demo a new feature. The sales team will talk about a new customer application. And that consistent communication, you know, we used to do all hands, an hour all hands once a month. We went into breaking that up into 15 minutes twice a week. And that's been very helpful. Also doing more daily stand-ups on Zoom. You know, early on, we also were like, oh, how are we going to onboard new employees? Are we going to be able to onboard new employees? Now we've onboarded like 5 or 6 new staff member, and it's forced our onboarding process to be much more rigorous in terms of, okay, here's what we want you to accomplish in 30 days, 60 days, 90 days. And so it was a very quick adaptation. It was stuff, if you were to ask me 6 or 8 months ago, do I think we would want to be a fully remote culture and company? I would say no way, absolutely not. And I think if you were to ask me that today, well, I'm sure we'll get into this a little bit later, I would probably say we don't want to be fully 100% remote as a company. I think the human interaction is actually really important, but there have been a number of positives in terms of growing as a team. Being there to support each other through a very uncertain time period was really important.
Well, certainly it's easier for, I guess, for the people who've been there, but because you already kind of know each other. If you're new to the system, then you don't necessarily know anybody. So it's hard to go find that person. You know, you normally lean over to the cube next to you and say, hey, where's the water fountain? What happens next? But maybe with that, Beth, I think you have a unique perspective, because like Brad was dealing with a very, I would say, a incredible lack of information, and maybe a whole lot of misinformation being in New York, in the city, during the early days. I mean, this is sort of modus operandi. It's typical mode for a doctor to work in a hospital. You know, A, that, and B, you know, what were the initial weeks and months like in the hospital environment?
It's interesting because we sort of did the opposite, where we all said we have to be in here together. And so we kind of, you know, clustered in, and we created a COVID bubble early on, at least within Seattle. And so Seattle never got hit the way that New York did, but we were one of the earliest sites. So we were kind of in this from the very beginning. And the team, understanding that we were being asked to do things like come up with face shields and face masks, felt it was really important that we were in the hospital together. So we created a little COVID bubble. And we've had daily interactions throughout this entire process. But I think the really important thing is we couldn't do it alone. And so we created all of these collaborations externally. And that's actually how I met John, is through one of these collaborations. And one of the key factors is understanding how you build that relationship and that working relationship and all of the trust that you need to work closely together across distance. And I think that that's been a very interesting learning opportunity. I was just reading about empathy and how it's much more difficult to have empathy in a virtual space. And obviously hospitals and care is based and seeped in empathy. So we're trying to figure out how we do all of that. But yeah, very, yeah.
In addition to learning how to be on a camera as opposed to in person.
Yeah, absolutely.
Sorry, go ahead.
No, I was going to say the one saving grace for us, though, that I did want to mention is one of the strengths, again, for Additive is it is digital. A lot of the workflow is digital. And within the VA, we had been working the past several years to understand how to work across distances, just because the talent that you need for this job is few and far between. We're looking for people that know how to use CAD, how to 3D print, understand anatomy, can talk to doctors, can design novel devices. And those, we call them unicorns, obviously. Who are these people? And so we realized that if we took the entire VA, 170 hospitals, 400,000 employees, we had those experts, but there was no way we're going to have them all in the same place. So we've been working the last several years to think about that digital infrastructure and how we share across the hospitals. So that actually came in very handy with COVID. So
interesting. And so Benny, probably a lot like Brad, you had responsibilities to get product out the door, but maybe a little bit unlike Brad, your product is very physical and not as much digital. And I think in one of our earlier conversations, I think it was certainly it was a virtual conversation. I don't remember if it was live or I think initially it was just through email, and then we ended up having a call. But you had some interesting perspectives on what's our role as leaders, not only of the company but maybe in the space, to exert influence.
Yeah, one of the things that Brad mentioned, his board member that predicted in early March that this is going to go through Labor Day and maybe beyond. And one of the things that to me was surprising and consistent is how at every stage of that, we were behind the curve. Reality was unfolding and we were, first in denial before we were accepting it. And it took me, at the beginning, it was really stark. That I remember when we started to ask the question, so someone brought up the point that it's possible that schools in the Bay Area will get closed. I was like, there's no way, this is never going to happen. Schools closed, there's no such thing. I was like, well, it happened in Japan. I was like, well, it will not happen here. And 3 days later, it was really 3 days later. So it's kind of amazing how close you are to something and you still are in denial of that. And this happened to me quite a few times at the beginning, and maybe around the beginning, middle of March, I started to realize what's going on, and I realized that the greatest responsibility for us is to contribute to the effort to stop the spread, the exponential spread of the pandemic. And we, since there were no rules, since there were no guidelines yet at the state level or federal level, what I decided to do in our company is unilaterally put us into very extreme measures of quarantine or shelter in place, and recommend people that we were interacting with to do the same. Because it became clear to me that there is a big argument around, you know, how should people behave? You know, should people socially distance themselves? Should people wear PPE, etc.? And to me, it became clear people should be as far away from each other as possible to slow this down. And we as leaders have to help with that and reduce the pressure on our people to be in a state that they can be compromising this mission. So we did that. And so you're right that we have a physical product. We also have a lot of software component, lucky for us, because this part was able to continue going really smoothly. And so it turns out to do software development remotely is relatively easy. To do a physical product remotely, not so much. So that turned out to be much more difficult. And at the beginning, we suffered quite a bit because of that, because we are building product, we are doing experiments in the lab, and that was pretty hard. When the county here came up with clearer instructions, allowing companies to have minimum infrastructure operating in order to allow the rest of the people to work from home, that started to allow us to be more productive. So we started to have few people here in the building, initially at shifts of 2 people. So this is a building that is more than 10,000 square foot. So 2 people in a building is you know, feels very safe. And later on, when we felt very comfortable, we added the 3rd person and 4th person. And today I can say that we basically have a policy where people can come in, do the experiments that they need. They are testing for oxygen and for temperature. They're registering where they're in the building, and they're in PPE all the time in. And even though we have less than 10 people in the building at a given time, the productivity is actually completely normal. So people are doing all the experiments that they need to do here, but they are preparing them and analyzing them from home. So it turns out that it's surprising how little physical presence in the facility is required to make even a physical company working and being able to move along. And the big challenge for us later on was, how do we deal with field service engineers? So all our actual COVID cases were field service engineers that got exposed in customer sites. And how do we deal with salespeople? And the salespeople, it was very easy. So we basically said no travel, no conferences, no physical meetings. And it became, as time went by, it became easier because it became the norm for our customers as well. So our customers don't want to see us anymore physically. They are also in isolation. But at the beginning, it was a little weird and it was difficult for people. But I think the big question that I think we all are facing now is, are we again in denial? Are we again behind the curve when it comes to getting out from the pandemic?
Yeah, and I think that's kind of something that I think's a little bit interesting, and I continually, it seems like you can't ever relax, but that's just, I guess, the nature of being a business owner. You know, for our point of view, we created an Excel spreadsheet because we're all engineers, and so we had an instance where one of our staff was due to go to Germany in March, you know, for an event that we've been invited to. And, you know, we looked at the the global factors and then the personal factors, and we're like, this is a no-go. This doesn't make any sense. This would be insane. And sure enough, you know, had that person gone to Germany, they would have been stuck in Germany because they wouldn't have been able to get back out. So, you know, it's a little bit of predicting what in some cases, it's a little bit just like the movie, Benny. It's like, you could never predict this stuff. Who would have thought we'd been talking about flattening the curve, you know, ever? Like, how do we get to that point? So every day after that is a little bit like, okay, let's see what's next. So I think, you know, this prepared piece, and I want to say, let's weave in this notion of people adapted to being remote, and it became, I think in that process, you have to adapt that you're producing something still. It's not, you're not, you know, your metric isn't show up at work and be there for nominally 8 hours and go home. How much of that is for your individual pieces? How much of that is really sinking in, or do people get it, or do they still think like, hey, this is like a gap year?
I think Beth is trying to talk, but you're muted, Beth. Oh, well, deep in thought. So I was going to say, I mean, for us, we converted fully to being about delivery, and since, you know, if you look at our metrics in terms of new just output, we've actually almost doubled in productivity since the lockdown, and we haven't doubled in terms of team members. We've added less than 10% of the team members. Now, with that said, I still think what has been missing is the human interaction aspect of productivity. And, you know, there is the role of the office beyond just being a place to, you know, get away from your family that you're in the same room with the whole day and have a place that's quiet to work in. The role of the office is for those kind of random interactions and random meetings and the camaraderie that you get from that. And so, you know, we've been doing other things to try and make up for that, but it's a very difficult thing to do in a remote environment. And, you know, just like Benny, I'm sure having a couple people that are able to go into the office and interact, even socially distanced with PPE on, is still better than being fully 100% remote at all times. I mean, we've been doing actually like outdoor meetups for pizza in the city, which has been really nice. And as things start to become more open outdoors, starting to do more of those human interaction aspects, even if it has nothing to do with work, it actually has a benefit into the normal workday.
Yeah, it's interesting you mentioned that, because I was talking to Jeff Mize at Post Process on Friday, and he was the first time in their Buffalo operations in a long time. And he just, you know, one example he had was a hallway conversation that I guess one of their customers was experiencing some sort of issue, ran into somebody who had nothing to do with it, and said, oh, it sounds like this thing that we had, you know, a couple of years ago. And he's like, sure enough, he's like, just, you know, you go talk to this guy and that guy, and then problem solved. But if it weren't for that sort of hallway moment, who knows how long it would have persisted.
I think one really critical component for in-person interactions, at least for us, is in product design. So we've found ourselves trying to design many products, and we're new to this space, but in terms of being able to rapidly iterate, understand what the user needs are, I don't know how you do that virtually. So for example, last week, we're looking at this glide scopes. You know, this is a device that helps with intubation. And, you know, it's a physical device. You need to understand how to use it. You're going to put your hands on it. We want to, you know, talk with the anesthesiologist and see how they're using it. And in the course of 2 hours, being able to be in person, all of us touching it and talking, we came up with about 3 or 4 things that we needed to change about the design. And honestly, I don't know how you do that virtually. So some of these elements, and again, I don't know if that's just because we're so seeped within the hospital in the being in person and touching and communicating, and maybe I'm missing some key component that the others on the panel can share and how to do that. But just certain things I feel like you just can't take virtual.
I would take it even one step further. You know, you touched upon something that is physical, but what I found is when we are trying to do brainstorming sessions, and it's not even brainstorming, but when you're trying to solve a problem that you sometimes don't know exactly what the problem is. So there is a step of, you know, properly defining what is the problem, thinking about this. I found that getting few people into the room and just having these moments of silence where everyone is kind of thinking, and and you kind of see the whole body language of the people around you, right? And I think that when you are in this conceptual phase, there is no replacement to physical interaction. So really hard problem solving, you still want, I think, people in the room when you're trying to solve problems that are less concrete, less less straightforward. But the thing is, the vast majority of the work is still easily remotable, right? Not everything is like that. So there is a lot of stuff that can be done remotely. But then you have these moments that you actually have to have people that need to meet to work together, and you have to identify those moments and just do it. You know, do it safely, do it. We are very fortunate. We have a beer garden tent at the entrance of our facility, which turned out to be really prophetic because it's reasonably big. It has like 6 beer garden tables there. So when we meet, everyone takes a beer, you know, a table. And it's like it's automatically socially distanced.
So we should all install beer garden tables and tents in front of our.
I don't know how it's doable in New York, but
yeah, but no, and actually in New York, all the restaurants now are outside on the street, so it feels like you're walking through Europe or something with everybody's eating on the street now. It's kind of
yeah.
amazing, and some of the streets are closed, so you can bike everywhere. It's awesome. But I mean, some of the interesting aspects where we have adapted, like from the customer interaction side, right? Like to be honest, I don't miss having to sit in a windowless conference center for 3 days straight in order to have interactions with customers. I mean, I think we're going to develop new ways of doing personal interaction with customers, like outdoor meeting with people or meeting over an outdoor, like at a outdoor table or something like that.
None of this is new to Benny. I mean, the first time I met him, he made me go on like a mile hike.
Oh, yeah, actually, me too. Yeah, we went on a lot. We went the hiking. Luckily, the hiking around Bellows' office is really nice, so we did the same thing.
They're always.
In fact, I think you let me borrow your sunglasses because I didn't have any.
So with this notion of like, I don't personally like the new normal because we just keep saying new normals. But you know, business isn't going to go back to what we were used to, let's say in January. You know, clearly we need to adapt. As I keep saying, we need to adapt, overcome, persevere. We did 2 senior projects, one at Purdue and one at Carnegie Mellon. And, you know, in the middle of all this, they couldn't meet together to do their projects. And some of it is, you know, inherently physical, and a lot of it wasn't. A lot of it, they'd already generated the data, so they just needed to go through the act of figuring it out. But I gave both teams, you know, huge kind of commendations because they could have just given up. You know, nobody would have expected them to, you know, have to put up with this, but then they wouldn't have learned as much. They found ways to meet through WebEx or Zoom or whatever, and they continued to share the data and continue to kind of progress the project forward. So I, you know, made sure one of the things I wanted them to appreciate was that they actually did adapt, persevere, and overcome. So they didn't let the circumstances dictate what their learning was going to be. I guess the question, so we've kind of touched on some of this, like, you know, I don't know how much of this is sustainable, how much of it will go forward, how much of it will present itself as a mix. A huge part of it is trust. I mean, the trust had to be there all along anyway, but now it's really being tested. to say that we expect you to do this great work. We expect you to do it here where we can see you to, we're just not going to hold you accountable to doing the work, and where you do the work, we don't really care. I remember having a conversation when I was at Skunk Works. I was in Atlanta and my boss was out in Palmdale, and I said, finally, I got exasperated with him and I said, have you found this conversation useful? And he said, yes. I said, if I told you that I was having it from home, would it be less useful? And he said, well, that's not fair. So, but it's, I think, the point of some of this. And so I know in our pre-call, there was a lot of, we had a strong theme around trust. And I want to pick up on that here in a bit, but I want to talk about the additive manufacturing piece just a little bit. So, you know, we talked about the need, everybody's talked about the need for additive to kind of transition out of it can do anything to it's going to do some things really, really well. And we've got better tools now. You know, nTopology is a tool that I would say that has enabled some of that to come to life. You know, Benny, clearly we're fans of the Velo 3D suite of technologies. But to somebody like Beth, you know, she just needs to use them and make sure she understands how they can be used. So I want to pick on some threads there where you can each kind of take your own element. But, you know, I know with Beth, we worked on this mask solution. And that was, you know, predicated because we had a mutual acquaintance in Andy Christensen who, you know, I think basically granted, you know, let's say trust or some ability like that precondition of trust was already there because we knew the same person. Whether or not medical will the medical, let's say, system, you know, learn anything from this, what's possible with additive. So, you know, maybe each of you could address that from your own angle, not necessarily the medical piece. I think I'm picking on Beth specifically on that one, but, you know, what are we learning there and how are we going to adapt and hopefully, you know, accelerate? You know, this was a thing in the conversation with Brad was when you have this shock to the system reacts. So, you know, our reaction was as an industry, a little bit more hype. We can do everything. We'll print anything, whatever you want, we'll print it. It doesn't necessarily mean that it's safe and it doesn't mean that it's fit for purpose. Discuss.
Well, so from the software side, I mean, I think it's really the on one hand, there's the trust in the, you know, legacy. The way that you would sell is you'd have like a VP going in and playing golf and meeting in person. This transition to being remote has cut that out. And so now it's like, hey, as an engineer, I just want to try the software. I need access to it. I need to use it. It's more like the proof is in the actual use and the application. And so specifically with us, it's really accelerated us honing in on what those applications are that we really excel at, right? Like we're not a full replacement to a legacy CAD and engineering stack, but there are certain problems that we could solve infinitely better because those tools were just never designed to solve those problems, whether it's like, you know, the osseo integration, generating some structure for a medical implant, whether it's tuning the geometry of a bracket for an aircraft to cut 15% of the weight off. And, you know, what we've done from a company standpoint is made it possible that we can ship those applications specifically to the customer and they can just get their hands in and try it. So it's almost flipped the sales process around to really leverage addressing the actual users in the room and having them use the software and prove it out rather than having a sales process that's locked out, that locks out the new coming or up and coming companies because a company has this pre-existing relationship. Now, and that trust can be developed through usage. But I think when you look at other digital systems, trust is such an important part of that. But I think in our case, it's about proving it out, right? Like you guys show all this cool marketing material. Like it's not just the marketing material that will sell anymore. Like the marketing BS, that was like the legacy way of selling. Now it's, let me try it. Let me use this. Let me see if I can get it out there. And I think, you know, I would say like because we sit early in the process, I think that's something that you will start to see from the machine manufacturers as well, where it's like, hey, I have this idea to redesign a part. Let's prove it out. Let's test it out and see that you can actually do this. And once that app, like, again, it could be designing a really lightweight satellite out of Inconel, which you would never build structural parts out of, but because you could 3D print it so thin, you could actually make it lighter than aluminum. The proof is in, hey, here's my part. I can actually do this. It's not like I need to spend a year playing golf with the executive and showing marketing material for them to say, okay, I'm going to agree to this and then prove it out after. The proof is in, let's just do it and let's get it out there. And go ahead.
Sorry, I was just going to say, but how much of that is also being available afterwards? You know, that's what I find in some of the surveys that we've done recently. It's being almost service after the sale, let's say, basically, you know, responsiveness to questions. I have a simple question, and it seems like that's something that your guys do particularly well, either because they're not in a big company, so there's nobody telling them, no, it's not your job to talk to the customer.
I think it's the whole interaction that you have with the customer is much more about supporting the usage and the application and making sure that they're successful. And I think, again, you know, because we're focused on very specific problems, we could really go all in on that and make sure that the experts on our team could help to train other experts out there in solving those problems with this new technology. And so I think it's really end-to-end focusing on the user and making sure that they're successful through that process. And we have some really amazing partners out there, you know, like Velo, to ensure that the stuff that is happening from the design side can make it through, and you can get a part that you can then put in an airplane if you want, or that can go into space and be successful.
Beth, what would you say on the medical front, you know, about this, I guess this kind of proposition? I mean, we'll let Benny and Brad do their love in there with Velo here, but let's bring it back to the medical
Well, there were
perspective.
two pieces in this thread. One was about trust, and I think the other one was about what can additive do. So I'll try to touch on both of those. I think first, just along the theme of trust, it's very important within the hospital. It's critically important. Trust is probably the most important asset that you have in medicine, because you need patients that trust the medical staff that trust the patients, and it just goes out from there. And I think also for us, we had talked about this before in our conversations. Oftentimes within medicine, you're operating with part of the information, but not all of the information. And you get used to doing that because you have to make decisions fast. Oftentimes you haven't seen things. COVID is a perfect example of this, where we're trying to learn on the fly. We don't have all the information, but we don't have the luxury of waiting to get that information. So you operate with what you've got. And in that case, what you've got, it needs to be correct. And so if what you've got is coming from somebody not trustworthy, you're in a really serious situation. So we are always looking for, who do we trust? Who gives us the best information? Because that's going to allow us to succeed. And I think you see that moving not only just from medicine, but over into how we think about products and interactions and relationships beyond that. And if we kind of dovetail that into additive, it's really important for us to understand what tools do, whether that's software or 3D printers or, you know, contract manufacturers that we're working with. We're really looking for partners that understand that need and honor it. And so one thing I was thinking about when you mentioned Andy is this concept of almost like a trust broker. And you have these, you know, I think maybe in this new post-COVID world, trust brokers are going to become even more critically important. And, you know, I'm going to have to take the person I trust and listen to who they're introducing me to and extend that trust. And I think that also, you know, there's opportunities and pitfalls there too. So you almost, as a trust broker, it's even more precarious because you can burn your broker ability with the wrong relationship. So that's my thoughts on trust. I did want to also just touch briefly though about additive and what it can and can't do, and the hype and the reality, because this, you know, this is our daily life. We get tagged every day. Can you make me this? Can you make me that? You know, a lot of things that are missing in the supply chain that we need. And I think there's a lot of confusion in medicine about what 3D printing or additive does and doesn't do. And it's almost a surrogate for just rapid manufacturing. You know, so the words, there's some interesting, you know, concepts about how we all understand what the technology is. But I will say that it is oftentimes the right solution for prototyping, almost always. You know, whether or not you plan, and this is kind of the ship that we're taking is, should it be 3D printed? The answer might be a resounding no, but should additive be used to prototype that? The answer is almost always yes, if you can, because we're strapped for time. Again, you know, we have days instead of months or years to develop product. And there's something really satisfying about having prototype, you know, with the mask, with the glide scope, with many of the things that we've made, we are iterating on prototypes on, you know, a 10 to 20 hour, maybe 30 hour, depending on what printer we're on, cycle, so that you can, you know, go through 10 different prototypes and iterations across 2 weeks. So I think it definitely plays a critical role there. And we just need to divorce the idea of what the end product is from what the development process looks like in times of crisis and compressed timelines.
That's, I think that's an interesting thought. And the one thing I am kind of curious about is, you know, with additive, we always talk about requirements, and everybody has requirements. Sometimes we don't necessarily appreciate what the requirements are because we're just replacing like with like and kind of turning the crank. You know, specifically, you know, I think throughout this process and the project that we worked on, we inadvertently made a product which almost didn't fit a category anymore. You know, a reusable sort of mask wasn't something that the FDA has a category for. So is the answer to not do that? Or is it to create a category, and then how do you go about doing that? And it struck me that it didn't seem like it's symptomatic with other industries, which is whether it's in aerospace, you know, largely if you make the 787 and you look at the 777 and you look at the 747 and you look at, you know, all the previous versions of it, they're not hugely different. You know, the aerodynamics is different, the engines are different, but the way that the plane was constructed really isn't hugely different. So we've forgotten like why we do it that way, because some guys in the 50s figured that out. So how do we go back to what the requirements are and rethink the solution again? And I think, my opinion, this is where we bring in the nTopologies and other generative type tools to discuss that, because they don't care about any of that. They just want to know what the loads are, what are the interfaces, and let us figure it out from there. But, you know, I guess through that long tirade, coming back around to how is additive ultimately a solution for, let's say, a good chunk of things as far as the FDA is concerned? You know, if it can meet the requirement, but it creates a new category in the process, I mean, that's almost basically the same as not meeting the requirement, it seems like. So there's flexibility needed on both sides. You still got to do no harm to the patient, but are we going to get to a point where we say, hey, there's actual goodness here, but we need to think about how we define this thing?
I think that one of the amazing things is how proactive many of these groups have been, including the FDA and NIOSH with products. So they've been very communicative, I believe, in terms of opening up doors and thinking about possibilities and trying to innovate along with the field. And, you know, we have a partnership. VHA partnered with FDA and NIH and America Makes early on in this process to work together. You know, we talk daily, actually 7 days a week through the first several months of this. And then we kind of cut it back to 5 days a week. And now we're at 3 days a week, but we talk, you know, for an hour every other day in the morning about these. So I think the bottom line, I think, is that we should not be afraid to innovate outside of the bounds of where we think the regulatory is. I think the regulatory will come with us. What we do, though, is think about the best products and the needs. As you said, if you can strip it down to what are the essential needs, you know, a mask, what is the essential need there? It's not that you put a covering over your face. It's the essential need is something that prevents the spread of, you know, virus out from the patient and into the patient. And you might want to separate those two out, right? It might be that it's specifically I'm infected, I'm trying to keep it in, or, you know, I am a critical care worker, I'm trying to keep it out. But if you separate it out and you just take it down to that most essential need, and then you create a product that meets that need and you can demonstrate it, the FDA will understand that. And so, you know, and everyone else, the doctors, the healthcare, the patients. And I think, you know, what you said, John, is really important, is that we get indoctrinated into what a product should do. You know, this is something in human-centered design we talk about a lot. You hold up a fork and you say, what is this used for? And everyone says eating, but what else can you do with a fork? A million different things. And do you really need a fork? So when we think about the problems and we think about the critical needs and we design a product that meets those critical needs and we can demonstrate that objectively, it will make it through regulatory, it will make it into general use. And I think we just have to have faith in that. Otherwise, we're going to really miss this opportunity.
Yeah, certainly the idea isn't to eliminate the process. You know, that generally doesn't go anywhere productive, I would say. I mean, you know, who would have thought that a private company would be putting people out in space, you know, 15 years ago?
I was gonna say in aerospace, you're seeing the same thing happen with a lot of the startups that are building 3D printed rocket engines, that are building new aircraft. There's a platform shift that's happening, right? And the companies that are going to be successful are embracing in the platform shift, whether that shift is from gas powered to electric, whether that shift is from in-person manual to digital. I think and same thing in terms of category creation, right? Like that's ultimately a shift in platform, but it takes these, like your mask, for example, as an example of showing that this is possible. If you address the user if you address what the core problem is.
Yeah, it also seems like we're undergoing some sort of a shift, which should be a benefit to companies like Benny's, where economies of scale aren't as important. You know, we don't have to. So the reason why we have the surgical masks that we have now is because we can make a lot of them very cheaply, but there's no differentiation. That it is what it is, what it is, what it is. And, you know, I think what was interesting about what Beth was suggesting was, well, it's possible that we could differentiate. Everybody doesn't need the same mask. We have the ability to make smaller lots of things productively. And it goes down to electric cars. Well, if we're doing more electric cars and more ride sharing, we need fewer cars. So we see companies moving from out of the, you know, car manufacturing into maybe focusing on trucks, which, you know, feeds into this. And so I want to make sure, Benny, you actually got a question, and I think it ties in here. It's a little bit in that digital thread, and it's about this customization piece, but specifically the question was, do you see a future where machine and process demonstrations are possible remotely, potentially with, you know, VR and AR technology? So, you know, that's kind of a specific question that sits in the digital category of things, as allows us to do what we do differently. It's almost it's how you would do what Brad gets to do, which is demonstrate the software online. But you're getting to demonstrate how the machine operates almost online. And then, you know, with that, there's an implicit trust equation, because if I don't trust you, you could just be, you know, you could have filmed the whole thing and I would never know the difference.
Yeah, so I think so I think we are getting to this remote testing really quickly these days. So almost anything that you just said is already done bits and pieces to different customers, maybe not all of that to the same customer. And I think that the acceptance of being able to do a lot of this remotely is growing very quickly these days. I think there is something important about the trust piece. As I was listening to the conversation, the trust is really essential at the early stage of trying something. In order for you to try something new, in order for you to get into an interaction with a person that you don't know, trust is really critical to make this first step. Once you made this first step, now you can enhance this trust through your actions and through the things that you deliver, or you can wipe this trust by missing out, by not delivering on your early expectations, etc. So I think that as you, and that goes also for physical products, right? So you can, you need the trust to convince someone to try something, but once they get into that and they start to get the products, the physical products in their hands, and they can test them and they can see how the machine is operating, etc. Now it's like trust is not part of that anymore. Either it works or it doesn't work, right? And if it doesn't work, you're in real trouble. And if it works, you really build a trust that is much higher level, because it's a trust that is built on actual facts. So I think people are. You can have trust brokers. You can have relationships to help with this initial test, but you absolutely have to make sure that you're successful with this initial demonstration, where people actually are basically, they made a leap of faith to let you in, but now it's up to you to stay in or to be kicked out.
Well, and I think the training behind that is also important, right? Because if you get to see it and you get to see the problem solved initially, then it's like, okay, now you want to become an expert in that, and so that follow up as well.
Right. Right. But ultimately, it comes to how you as a company treats your customer, and do you treat your customer as people that you are committed to their success, or as basically stepping stones for you on your journey?
Mm-hmm.
Right. And if you're absolutely committed to their success, and your team is aware in a very visceral way that you and the whole company is committed to their success, to the customer success, it builds a dynamics that is reinforcing this trust.
Yeah, and I think a certain part of that obviously is set by what's the expectation. But you know, certainly from what I've learned, moving from a corporate role into, you know, a small business role, specifically, you know, where we sit in the industry, for us, if people don't trust us, we don't exist. You know, it's that's just, those two things don't go together. So it's critically important, you know, for us and what we do. And I think back about my days at Lockheed. You know, you were necessarily doing something that nobody had ever done before. So it wasn't, my trust of you wasn't that you knew how to do it. My trust was that we're going to figure it out together. I already know you don't know the answer, but the question is, how much are you willing to lead me on to think that you can solve it? Some of that's on me. So we just got a few minutes left. So I thought maybe I'll turn it over to you to leave your parting thoughts on, if you happen to know what's going to happen in the next 3 months, that would be interesting to share. I'm sure the audience would like to hear it, but certainly I appreciate, all of you willing to spend the time this morning. And anytime, I still look forward to actually meeting Beth in person. We've never actually had that privilege, but one day I'm sure that we will. And for those of you that haven't gotten a chance to go on a walk with Benny, or go have coffee with Brad, or go on a run, that was something we were going to do in Germany, which we didn't get a chance to do. But
yeah, exactly. That's the one thing I was looking forward to at the conference.
Benny, you want to lead off with some thoughts?
Yeah, so I will end where I started with this, which is, I think that one thing that this pandemic taught us is how difficult it is for us to see how this thing is going to develop. And I think that as we are now facing another fall and winter coming after that, and as at the same time we are getting to a place where maybe medical treatments are getting to a point where maybe we can win over that in the foreseeable future. This fork of where this is going is as uncertain as it was in March of 2020. And I think that being open, listening, following, looking at the numbers, trying to understand what's happening, I think is going to be crucial for us to be able to make policy decisions at macro level and at a micro level. So unfortunately, I don't have insight of how this is going to develop.
Yeah, I mean, I think for us, it's really we've learned how to make the decisions with the limited data that we have going forward. And I completely agree with Benny in that there's just as much uncertainty now about going forward than as there was in March. I mean, I think, now we could eat outside in New York City. Are we still going to be able to do that in the winter? Are people going to have heaters? Are people not going to have heaters? Are we going to be able to meet in person? Is there going to be a medical treatment that's going to make people feel like they are comfortable going back into the office? Will we even feel comfortable working in the office? What is the nature of work going forward? I mean, I think this shock to the system has, I think the benefit has been we have a much more open mind in terms of ways of working, ways of building software, ways of shipping software, ways of selling going forward. And I hope that we continue to still have an open mind and not get set in a certain way of doing things, and that the policies that we develop reflect that. And so whether it's starting to have a more hybrid type work environment going forward that is more responsive to issues as they come up. I mean, there could be okay, we have the COVID-19 pandemic. What happens if there's another pandemic? Will we be more prepared going into it than we were for this one? Was there stuff that could have been done from a policy standpoint on a more national level that could have made us more successful? I mean, I think those are the learnings that we'll see if we actually learn from or if we don't. But I think this type of shock has given us more of an open mind, and hopefully we'll continue with that.
Beth?
And I would just say, I think one of the critical lessons learned we've seen here is the delay between cause and effect. From the time you get infected with coronavirus till you see symptoms, there's a lag. From the time when we've seen, changes in behavior to infections, there's a lag. There's a lag between infections and death rate. And those lags get longer and longer. And so from our perspective, I think at least within the medical world, is that we've just sort of buttoned down, and this is reality for 12 to 18 months. And we're going to operate under that reality. So it's a little bit different. Maybe it sounds a little bit more bleak, but I think, you know, even when you think about supply chain or bouncing back, let's say there's a vaccine tomorrow, fantastic, but we still have a lot of work to do to get back to normal. So I think my lesson learned, at least, is to stop thinking in days and weeks and start to think in months and years about what the strategy is. And, you know, hopefully we're wrong and, you know, everything's great in a couple months, but I think for us, at least strategically, there's a shift, a strong shift to be thinking about the next months to year or two and how we plan.
Great. Well, thank you for that. And as always, for those people in the audience, if you like what you heard, you should hire us to do some work with you. But in all seriousness, I think, yeah, the lesson learned for me is that the answers are always there. We just got to figure out, we got to be smart enough to ask the right questions and rely on our teams to give it to us. Really, you know, that trust breeds confidence. If you don't have the trust, then you're not going to be confident. Then you probably aren't going to get to your destination. So with that, I think we might wrap it up. And I thank everybody for participating. It was great to see you this morning.
Yeah, thanks, John. Yeah, thanks.
Right.
And Benny, Beth, good conversation. John, thanks for organizing this.
Thank you all.
See you guys soon.
Bye.
Bye.
All right, thank you.